whereas a marginal previa partially covers the os. The classic presentation for placenta previa is painless vaginal bleeding. Placenta previa is diagnosed by ultrasound. Remember that with a placenta previa, a digital cervical examination should not be performed, for digital manipulation can cause bleeding. If there is heavy bleeding, volume resuscitation, and possibly betamethasone for fetal lung maturity. Delivery with a placenta previa should be performed via a cesarean section. There can be abnormal extension of placental tissue. Placenta accreta involves extension of placental tissue into the superficial layer of the myometrium. Increta involves extension further into the myometrium, and percreta involves extension completely through the myometrium to the serosa and sometimes into adjacent viscera. Placental abruption. This is vaginal bleeding with abdominal pain. Here is the placenta that is normally attached to the endometrial wall. If this starts to separate with a placental abruption, then there is usually painful vaginal bleeding. Note that there can be concealed bleeding if the blood is trapped behind the placenta and cannot exit. The term cuvulare uterus refers to the extravasation of blood into the uterine musculature, which causes the uterus to appear purple or blue. Risk factors for placental abruption include trauma such as a motor vehicle accident, domestic violence or fall, cocaine use, hypertension, and multiple gestations. The diagnosis of placental abruption is by clinical examination. The management of placental abruption involves monitoring of the vital signs, fluid administration, close monitoring of fetal heart rate pattern, and delivery for severe hemorrhage. Note that abruption is the most common cause of coagulopathy in pregnancy. Let's conclude that 1 unit of packed red blood cells raise the hematocrit by approximately 3 to 4%. A key point to remember is that oxygen delivery is greater than 4 times oxygen consumption, so there is always enormous reserve. Why it is so important for our anesthesia colleagues to aggressively give IV fluids during a hemorrhage in order to maintain this intravascular volume. In cases of massive transfusion, if only red blood cells and crystalloid volume are administered, then there will be dilution of the plasma clotting proteins. In general, when the hemoglobin is 6 to 7, a transfusion is recommended. Between